Hi, everyone, and welcome to Wound Warriors. This is the first of its kind podcast devoted to amputation prevention when it comes to diabetic ulcers. Did you know every 1.2 seconds, someone in the world has a diabetic ulcer that emerges that could lead to amputation? It's true. But with the early diagnosis, early treatment, and in fact, the right treatment, you could prevent amputation. With us is my co-host. It is Kay Smith. She's a nurse practitioner, also board certified in wound care. And every single week, we are going to be here right at this time to talk with you live and answer your questions live, because it's so important for that real-time support when you're caring for these wounds and to prevent amputation. Right now, in this one, we are going to be focused just on the basics of wound care at home. Welcome, Nurse Kay.
Good morning, or good afternoon, or evening, whatever you are in the world. And I'm delighted to be with you.
And would you mind sharing just a little bit of your story as well? You're not only a nurse practitioner, but you are also a patient with PAD.
Yes, I am. I have been a qualified nurse for over 30 odd years. We won't say how many. And most of that's been involved in wound care because that was my passion. And I traveled the length and breadth of the UK, teaching and introducing new technology, etc. I did my qualifications in tissue viability. And I was extremely passionate about it. And then I discovered that I was struggling to drive and I was getting cramped when I drove my car. And then I was struggling to walk. And I think people thought I was just being lazy when I said, you'll need to get me a taxi. And eventually I set off on a journey, which was 4.5 hours. And after half an hour, I knew I was not going to get much further. So I turned back and went to my local hospital. And my toes were blue, and they immediately took me in. They thought I was having a heart attack, but I wasn't. Referred me to vascular, and it all went from there. And eventually I got diagnosed with distal aorta, 95% blockage, iliacs, SFA, popliteal and tibial blockages in my left leg. So I am PAD. I'm a PAD patient too.
So what is it like for you going from one side of the bed, in a sense, to the other? Has there been any eye-opening moments for you in this journey?
Oh, definitely a few. You've got the old school vascular surgeons who don't like the fact that you're clinically qualified at all. So you have to be very careful what you say to them. And you have the new up and coming endovascular surgeons who just can't get enough of your input, and they want to hear more from you and how you see it going forward. And they look at it completely different from the old school vascular surgeons. And I find that a massive contrast. But I also find the biggest deficit in vascular care, both in the UK and in the USA, is in social care. So you've had your consultation with your vascular surgeon, you've maybe had your procedure, you're sent home, and there's this gap. And that gap means that you're left on your own all of a sudden, and it's, well, I've got a discharge letter, but how exactly do I go about cleaning this? And oh my God, everybody can cope with somebody else's wound, but nobody wants to touch their own body. So all of a sudden your body's got a wound and it's like, how do I clean it? How do I look after it? I don't want to touch it. It might hurt. From the patient's perspective, I can see that because I can treat my husband, no problem. But when it comes to treating me, I'm like, So you have to put yourself, stand aside and put your professional cap back on again. And it's basically, when we decided to do this, I thought we'll take it back to basics, because if we take it back to basics and then work through and get into more in depth as far as wound care is concerned, people can follow the story through. So today's all about basic wound care once you've been discharged from the hospital and you have to change that dressing for the first time.
Right. And I think it's important to note that you don't get to see the doctor every single day. You are discharged, and these wounds can change very, very quickly. And
very rapidly.
The healthcare system can't support a real-time daily check-in on your wounds. And so it really becomes up to you to become the expert of your wounds. And that's why this is really important with what we're doing.
Exactly. I mean, what happens if something happens past 6 o'clock on a Friday night, and that's going to be you till a Monday morning? And that is a really big issue, both in the USA, in the UK, in Europe, everywhere. And unless you take yourself off to ER and go through the whole ER process, learning how to cope with it yourself, learning when to know when it's time to call a doctor, when it's time to just change the wound, when there's warning signs, etc. That is so important to each and every one of us that's got PAD.
And I think it's really important to note as we move forward with offering you some educational and, and informational content here, remember that the advice and views offered is simply that of us, the speakers. It's purely to support what your doctor is doing. It's not to replace what your doctor is doing. So any advice offered here, remember to check with your own healthcare professional before following any of it to determine if it is in fact right for you. And with that being said, Nurse Practitioner Kay, why don't we start with, we're talking about the basics of wound care at home, and that begins with cleaning your wound.
Yes. Yeah, I mean, changing your dressing is a big issue. And quite often I'll get messages from people saying, is it ready for changing? Is it too early to change it? Go by your discharge form. Your discharge form will be very specific about when you have to do your first dressing change. So to change your dressing, the first thing you must do, well, you're going to be doing it repeatedly, but is to wash your hands thoroughly with soap and water before and after each dressing change and at every stage during the dressing change. You can wear non-sterile gloves. They're cheap. You can buy them at Walmart, Walgreens, Target, etc. Carefully remove the tape around your wound. You'd be amazed at the amount of people who are actually allergic to the tape and the adhesives on dressings. Try to take the old dressing out. If it starts to stick, the best advice I can give you is do not pull it or force it. Soak the dressing. Soak it with warm water, and if you've got some saline, soak it with saline, and then gradually it'll start to ease out because dried blood can hold the dressing in place. So gradually wet it with warm water, leave it for another few minutes, and every few minutes more warm water, and then gradually it'll just peel off your wound without sticking or doing any further damage. So remove the gauze packaging, remove any pads that are there and any tape around the edges. Put the old dressing, all the packaging material, everything into a bag and dispose of it properly, and then clean your hands. And that's basically just the removal of the dressing. The next is the most, I think it's the most important stage, is actually cleaning your wound. So again, you put on a clean pair of gloves. So you don't use the gloves that you've used before. Put a clean pair of wounds. Use a clean soft washcloth or some cotton wool or some gauze swabs, depending what you have at home. So you don't have to run out and stock up on everything in Walmart and buy loads of different gauze swabs, etc. You can actually just use a washcloth as long as it's clean and it's just out the wash and it's just soft. And you gently soak it in warm water with soap, and then you clean around the edges of the wound. Now, a small amount of blood as you're cleaning your wound is okay. If you start to bleed profusely, press the cloth onto the wound, hold it there steadily until the bleeding stops. And at that point, you're best just stopping, clean the wound as best you can, reapply the dressing and call your doctor, because no wound should have profuse blood coming from it. So clean it, don't rub it, just gently pad it or pat it dry afterwards. And just again, soap and water. Don't leave the soap in your wound, always rinse it just with plain water. Pay attention to the colour. Look at your wound. Make sure the colour's okay. Look at the amount of drainage that's actually coming from your wound. So look at the pad that you took off and make sure that it's not totally saturated. While you're doing so, check for any redness around the outside of your wound. Check for any swelling, and most importantly, when you take your dressing off, check for any bad odor, because that's not a good sign. Look for the drainage over time, if it becomes darker or thicker, that's another warning sign. And after cleaning your wound, remove the gloves, put them in another bag just for disposable, and all the dressing and the gloves, and wash your hands again. And then it's time to actually redress your wound. Now, again, it's put on another pair of gloves. Pour saline into a clean bowl, just a bowl that you have in the house, that just run boiling water around it and then put saline in it. Place God's pads and any packing tape that you'll use into the bowl so that they're moistened. As you use them, squeeze the saline out from them and squeeze the saline from the pads or the ribbon that you're going to be packing your wound from, and then carefully fill the wound in. Just using the tips of your finger, just make sure that you've pressed it in. You don't pack it in, you just press it in lightly. Cover the wet gauze with a large dressing pad. You might have an adhesive dressing pad to put over the top of it. A tip is, if you're allergic to the adhesive, is to get a hydrocolloid dressing, which is available, like Duoderm, etc., that are available from Walmart. And you can actually surround the edges of the wound with the hydrocolloid dressing, and then put your sticky pad on top of the hydrocolloid, so it's not actually touching your skin. So that will make sure that you don't take another or a further allergic reaction. You must make sure the wound is dry before you redress it, because round the edges of your skin, if you start to see the skin, if you've been in the bath too long and your fingers get all wrinkled and crinkly, that's because your skin is becoming macerated, and the edges of a wound might become all white and crinkly. And if they are, leave the dressing off for a wee while and allow that to dry out. So you've put your dressing back in, you've attached your wound pad, put all your supplies back into a plastic bag, close it securely. Well, it should be a paper bag nowadays, because we're all going to be less plastic usage. Close it securely, pop it in a bin, put it in your trash, and when you finish, wash your hands thoroughly for any contaminants that you've came across that might have been in the wound. That is basic wound care, how to take the dressing off, how to clean the dressing, but most importantly is when to start to worry, when you think you might have to see the wound care nurse, or when to call the wound care doctor. And that's if you maybe have inflammation or redness around the wound, if there's more pain around the wound, specifically when you're changing the dressing, or if you're getting pins and needles coming from the wound. Any swelling from the wound is not good. Any bleeding at all, as I said previously, that needs to be stopped, and hold the pad securely against it, and then you must seek medical attention. If your wound looks larger in any way than it did the last time, and a good way is to get a paper measuring tape and actually measure it. And if it starts to become larger, or it looks to become deeper, if it looks dried out, or the base of the wound looks dark in any way, then that's the time again to seek further advice. If the drainage is increasing, so your wound's starting to leak and you're having to change your dressing more often, again, that's the time to seek further help. And if the drainage, most importantly, if the drainage has a foul smell, again, that's time to seek further care. So that's to go to your wound care nurse, your wound care practitioner, or your local wound care clinic, and ask them to review your wound for you. And most wound care clinics in America and in the UK will more than gladly do that for you. Another warning sign is if your temperature goes up for no apparent reason. So there's no other illness that you've got, but if your temperature goes up and basic paracetamol can't bring your temperature down, that's a warning sign as well, that you've maybe, the infection in your wound has maybe become systemic. If drainage again is coming from the wound and it's not decreasing after 3 to 5 days, you must go to the clinic. And again, the one thing that I always tell everybody is, if the pus or the leakage from the wound is not white or clear, and it becomes thick, it becomes yellow, it becomes brown or black, or indeed bloody, and if it starts to smell bad, don't hesitate, because bacteria can multiply so quickly. You have to take action immediately and get yourself to the wound care clinic.
we have a couple questions that are coming in. We have Sheila that wants to go back to the foul smelling odor, and if you can liken it to anything. I mean, sometimes she says it kind of smells a little bit like dressing, and that kind of smells, you know, to the dressing that you put on, and that it's been covered, and it almost smells like it's, you know, like moldy or damp. But you know, other times, you know, she's concerned maybe it smells like you know, old socks or dirty socks.
You know, the sweaty trainer smell, but it's like 10 times worse than sweaty trainers. That's dead tissue, that's dead skin. And if you start to get that odor, and how you can judge it is if you can smell it, okay, but if the person 2 meters away can smell it too, that's a good judge that the odor that's coming from your wound needs attention. So it's not just that you can smell it, the person in the same room can smell it, a person walking into the room can smell it, then there's the problem. So it's that sweaty trainer smell, and it becomes more and more foul as the wound becomes more infected, where literally you would almost feel like retching as you go to change the wound. And at that point, you must seek immediate medical attention.
But it shouldn't get to that point. If it does,
no.
Okay, you now know you need to go to the hospital and fast. But
immediately,
there are signs. You were mentioning there are signs. It should not get to that point of smelling, correct?
Yes, yes. The leakage, you're watching it, 9 times out of 10, it's going to be clear. It might be slightly blood-stained, but it should be quite fluid, yeah, and flow. If the leakage becomes thicker, so you notice that it's becoming more, it's thickening up. The color is so important. A lot of people say to me, I've got white pus coming from my wound. White pus is, and 9 times out of 10, it's actually a good sign because that's the skin starting to heal. But if that pus becomes yellow, green, tan colored, brown or black, that's an immediate sign that you need to do something, and you don't wait till tomorrow, you do it that day. You need antibiotics. If you get a temperature, you definitely, the wound is, we talk about localized contamination, and that's when it's just the wound that's contaminated. So you need antibiotics that'll specifically target the wound. If you start to get a temperature in yourself, then the wound is no longer locally contaminated, it's now gone systemic, and you're now suffering the side effects of having an infection in your wound. And the indicators are that you've got that temperature, and that's immediate, that's wound care, it's straight to hospital, that's ER, because you've now got a systemic infection. But redness, slight inflammation, larger than it was before, more leakage, the leakage starting to change colour, and that foul smell, all of those put together create a picture that if your wound doesn't look right, smell right, and you feel there's something wrong, there is absolutely no harm. There is hundreds of thousands of clinics all over the UK and the USA that will see you and take Medicare, Medicaid, and they will see you and they will check your wound for you. And that's the time to go again.
Kathy was asking about just basic infection, and that the redness has started to creep. And is it possible for a hospital, if you get there in time, to save your toe if that infection starts to creep? Will antibiotics be able to help that?
Yeah, what I tell people is if they start to notice that the redness is there, is to take a pen and mark around the edges of the redness. And when they change the dressing again, or within a few hours, if they notice that the redness has come out with the pen mark, then you've got an infection that's starting to spread rapidly. So you put another line. And again, you start to think, I need to seek medical attention, because things like septicemia and sepsis itself can spread so fastly that if you see within an hour that that redness is creeping up your leg, your toe or your foot or your leg, then you have to seek medical attention. So a good indicator, the redness, you're not sure, put a line around it with a pen. The doctors will understand when you get to hospital why you pen marked it. And if the pen mark, if the redness comes out with that pen mark, then you go take yourself off to ER.
And the earlier that you flag these issues, the better, because you would prefer to go to your regular podiatrist or wound care specialist versus going to an emergency room. In the
100%.
That's scary. I don't know about how it is in the UK, but here in the States, they're more likely to amputate in an emergency room versus in a wound care clinic. The problem is that wound care clinics here are so taxed. I mean, they have so many patients that we even have friends in our group who have these diabetic ulcers that can't get in for a week, even with symptoms of infection. And that's really scary.
Oh, the good part is that 90% of the wound care clinics in the USA are attached to a major hospital and have an ER. So even if you can't get to your normal wound care clinic, if you go to the ER that belongs to that hospital, they will send for one of the wound care specialists to come down and look at that wound while you're in ER. But if that redness starts to spread, that pain starts to spread, that pus has gone a funny color, get yourself to ER. They will get the wound care specialist. Even if you don't have an appointment, they have an on-call team and they will come down to ER and assess that wound for you. Because
and
the
make
last
sure
thing
you make
Yes.
sure you request verbatim, I want a wound care specialist to come down here, not just a
100%.
general podiatrist.
Yes, because if they send for the orthopedic surgeons or they send for anybody, that's red flags. You start to, oh my goodness, no, get me a wound care specialist. I want to see the podiatrist, etc. You do not allow them just to say, right, let's get orthopedics down to assess this wound. That's bad. You want a wound care practitioner to come and look at that wound. And those clinics are all attached to wound care and they all have an on-call team. Insist that one of the wound care practitioners comes down and looks at your wound. That could save your leg.
And are there any specific questions once the wound care specialist does come down? And it's granted, this is a loaded question because it depends on, do you have gangrene? Is it potential sepsis? Whatever it may be, there are probably a different set of questions for each situation. But is there a general set of questions that if you are sitting in an emergency room, the wound care specialist arrives, that you can ask that wound care specialist to ensure that they do in order to prevent amputation, or if they say amputation, that you will know, ooh, red flag, there may be another option. I am going to get a second opinion, or I am going to ask for one.
Yes. I mean, the first thing they need to do is take your bloods, because if the infection has become systemic and you actually do have septicemia, then they need to know, and the one indicator is your bloods. And they will look at your INR, which is your infection rate in your bloods. And they'll look for the white cells and the neutrophils and the eosinophils in your bloods. So you need to get your bloods done. When the wound care specialist arrives, ask them to look at your blood results, because they'll know just by looking at your blood results if the infection is localized or if it's systemic. If it's systemic, they need to treat you as well as the leg. So it's IV antibiotics, and it's not amputation. It's take the patient upstairs, get them IV antibiotics, and treat the overall condition first. And while taking basic care of the leg, but the most important thing is to get the patient well, because if you're not well, you'll not survive an amputation anyway. But the questions to ask are things like, what are my blood results? Is there any indicators in my blood results that this is serious? Is it just is it an infection? What can I do to prevent this? You're going to be discharged. They've looked at it and said, oh, it's fine, you can go. You say, what can I do to prevent this from getting any worse? Can you give me any wound care dressings that will prevent this from getting any worse? Now, they are wonderful products on the market, and silver dressings are really important to people with infection in their wounds. And if you get given a dressing and it says on it AG, which is the pediatric tract letters for silver, that means it's a silver dressing. Silver is antimicrobial. It actually eats up bacteria. And the other thing that everybody nowadays starts to talk about, but it actually really does work, is honey. And you get Medi honey dressings, which are soaked in honey, or you get the actual Manuka honey itself. And people say to me, can I not just go along to my local beehive, and buy some honey. Now, local honey does have some good effects, but Manuka is a specifically high-grade honey that has a very high antibacterial properties in it, and that's why Manuka honey is recommended across the world. There is certain places in the world where it is just impossible to get it, and it's impossible to get hold of Manuka, but you might be able to get Medi honey dressings, and they're not that expensive. I do find a massive disparity between prices of the dressings in the UK and prices of the dressings in the US. Prices of the dressings in some of our patients in the Far East. There is massive disparity. Things like dressings that stick to the skin or don't stick to the skin. But there's basic gauze swabs. There's things like NE dressings. Now, NE dressings have been on the market for as long as I've been a nurse, and the NE stands for non-adhesive. So instead of getting allergic reactions, just get an NE dressing if you can't afford anything else. It's a simple, cheap, effective way. But if you want to prevent infection, keep that wound clean. Dress it as often as the hospital tells you. My recommendation is every 48 hours. But that's maximum. Don't leave it longer than 48 hours because you have to keep looking at the wound to check that it's progressing. How do you check it's progressing? You'll see small white lines appearing around the edges of the wound. That's epithelialization. That's the new skin starting to grow. Just in front of that, the skin will be pink and fleshy looking. That's new flesh starting to grow. So that starts to show you that the wound is starting to narrow down. It'll become smaller, and that the edges of your wound are going to start knitting together. The cavity at the bottom starts to come up, so the wound gets shallower, and it doesn't hurt as much as it did before. And remember, when we've had a cavity wound in our leg, all the nerve endings are gone, so you're going to have less pain. So if you're getting pain from that leg, there's something wrong. Again, go to your wound care clinic because those nerve endings are dead. They shouldn't hurt.
Thank you so much, Nurse Practitioner Kay. We really appreciate you. We are going to be doing an interview every single week, either myself, both of us. Nurse Practitioner Kay is going to be also interviewing experts in the field. She's going to be introducing you to different products, and every single week we'll have new tips and tricks and valuable information that you can't find anywhere else. So make sure that you follow us on Facebook. Vascular disease support is the tagline. I forget what you call it. It's like @ vascular disease support, right? For the way to my heart. And then you can click on groups, and in the groups, you'll see one for wound care. And that's the one you want to be in for real-time support from our wound care team, including Nurse Practitioner Kay Smith. Just remember that the advice and views offered here are that of our team of wellness practitioners. Always, always, always check with your own healthcare provider to determine if the advice offered here is right for you in particular with your case. We don't have your medical records, and so we don't know 100% of what is right for you.
We want to advise, we want to support, but we're not here to tell you what to do. You must follow your doctor's instructions, but we're here 24 hours a day.
Yeah.
And we'll answer your questions and reassure you 24 hours a day. If you're worried about a wound, take a picture, send it to us, let us see what's going on. We'll give you advice.
We will. Just make sure, get on our Facebook page. It's The Way to My Heart. The tagline is @ vascular disease support. And then go to groups, and you can scroll down and find that wound care support group. And you are free. Our family and friends don't want to see our pictures of our healing ulcers or non-healing ulcers, hopefully healing. But we do. We want to see them. We want you to take pictures, and we want you to share them in the group. And we will provide some real-time feedback and some additional questions that you can ask your doctor about that particular wound to help you in the healing process.
Yes.
Thank you so much for everyone for joining us, but keep following us, and we are going to be coming to you every single week. And whether it's in our live broadcast where you get your questions answered, or in real time 24/7, we are here for you in this journey to better health.